nerve localization techniques in the peripheral nerve blockade. Paresthesia seeking technique. Success depends on a good understanding of the relevant block anatomy. The needle insertion site is identified based on the surface anatomic landmarks. As for example, muscles, tendons, bones, arteries, to estimate the course of the target nerve. The nerve is localized after needle insertion by eliciting a paresthesia in the distribution desired, which indicates that the needle is in close proximity to the target nerve. There is concern about paresthesias leading to long-term sequelae, and use of this technique has declined with the advent of alternative techniques that typically avoid the elicitation of painful paresthesia altogether. Nerve stimulation technique. Similar to the paresthesia seeking technique, the site for needle insertion is determined based on the surface anatomic landmarks, based on the most likely locations of the target nerve. Following the needle insertion, the nerve stimulator technique relies on the stimulator needle to identify the nerves by eliciting evoked motor responses in the distribution of the nerves to be blocked. Strength of the motor response, however, does not necessarily correlate with proximity to the nerve, although maintenance of a desired EMR at a current level less than 0.05 milliamperes is a commonly accepted endpoint prior to local anesthetic injection. A positive Raj test occurs when the EMR sedation immediately follows initial injection of local anesthetic, which is thought to be due to increasing the conductive surface area and decreasing the current density at the stimulating needle tip. Ultrasound guided techniques. The goal of using ultrasound is to directly visualize the target nerve and the needle placement. Target nerves can be imaged in short axis, that is cross-sectional, or long axis, that is the longitudinal views. Needle guidance can be performed using one of the two approaches: in plane, allowing for visualization of the entire needle shaft, or out of plane with cross-sectional imaging of the needle. While opponents of each technique discuss the theoretical advantages, differences in success of block or outcome has yet to be shown. The use of ultrasound-guided blocks is increasing in popularity, with many studies suggesting possible advantages of ultrasound-guided techniques compared to other traditional techniques. Less passes of the needle are often necessary with the ultrasound-guided compared to the other techniques. Due to the high cost of equipment, ultrasound equipment is not universally available. Therefore, the performance of ultrasound-guided blocks is not always feasible. Learning the ultrasound-guided nerve block techniques. Data regarding the learning curve for learning interventional ultrasound-guided tasks are based on studies involving inexperienced anesthesia residents. The most common error is failure to accurately image the needle during the advancement, resulting in inadvertent excessive depth of penetration of the needle. Inability to visualize the needle may result in unintentional iatrogenic injury in the form of vascular or neural placement and or injection. The learning curve is steep, and inexperienced practitioners are able to rapidly learn and improve and their speed and accuracy during simulated procedures. The American and European societies of regional anesthesia have published a suggested training curriculum for ultrasound-guided regional anesthesia. Now we come to the summary for peripheral nerve block overview. Definition. A peripheral nerve block involves the injection of local anesthetic near a target nerve to inhibit the neural transmission. This produces the surgical anesthesia in the distribution of the peripheral nerve and can provide the post-operative analgesia. What are the benefits of the peripheral nerve block? Avoid the general anesthesia and its concomitant risks like aspiration, post-operative nausea and vomiting, airway complications. Possible better analgesia compared to opioid, greater patient satisfaction, decreased pruritus, nausea and vomiting, improved sleep, and decreased length of hospitalization. Risk of peripheral nerve blocks vary with the type of block and include the infection, neurologic injury, local anesthetic toxicity, pneumothorax, ipsilateral diaphragmatic paralysis. Techniques. Nerves may be located by paresthesia, nerve stimulation, or ultrasound. Once a nerve is located, the single injection of local anesthetic medication can be administered. or a catheter can be left in situ for continuous infusion of local anesthetic medication. Now we come to the end of this lecture, and thank you all for listening.